Right. So we've got a nice case today. We've got volunteer. Thank you very much, Dr. Anne, for volunteering.
You're welcome.
You can all hear me loud and clear. Yeah. Okay. Thank you. Right. So we're going to do a quick case. So what this is going to involve is we're going to do a mock station. So we can do it under time conditions. So as you would in the exam, 90 seconds to read the task and 8 minutes to tackle the station. And then we will do a kind of 20 minutes personalized feedback, on how she did. Yeah. That's about it, really. So let's get into it. Really excited, by the way, because I've not really been doing much, group stuff recently. It's all been kind of private, one-to-one stuff, which is great. And I've been working kind of on the website, but it's really nice to go back, because this is how I started doing PLAB 2 cases. I started this as whilst I was preparing for the exam, doing like group sessions. We used to do like £3 entry group sessions. I'd go over we'd go over various different topics, usually like 4 in one go. And I was kind of preparing for the exam at the same time. It's slowly evolving from there. But I definitely want to get back into doing more of this kind of thing for sure. Okay. All right, so we'll get into it. Oh, thanks for turning on the camera. I do often ask people to, by the way, to turn on the camera just so that we can see, candidate's face, which is important, obviously.
Begin.
Good afternoon. My name is Dr. Anne Augustine. My GMC number is 12345.
Thank you very much.
Good afternoon. My name is Dr. Anne. I'm one of the doctors from the GP today.
Hiya.
Emma Willis, is it?
Yeah, that's me, yeah.
Hi, Emma. It's nice to meet you.
And
Could you please confirm your age for me?
Yeah, I'm 30 years old.
All right, thank you for that. So Emma, let's discuss why you've come here today.
Sure.
So can you tell me what is your concern?
Yes, doctor. I've come in today because I'd like a sick note, please.
Sure. Can we discuss a little bit about why you need a sick note?
Yeah, sure.
Okay. So are you feeling unwell?
No, I'm actually absolutely fine. That's not the reason why I need a sick note, though.
Oh, I see. Is there any particular reason why you need a sick note?
Yeah, so my husband, he's going on a business trip. He's going to Germany, and he's going to be gone for 2 weeks. And usually we split the childcare between me and him. I work 2 days a week. He works 3 days a week. So in between, we look after the kids. We've got a couple of twins, 2 years old. And because he's going on this trip, and I am working, we don't have anyone to look after the kids. So yeah, a sick note would be a good solution, I think.
All right. Thank you for sharing your concern. But I just want to ask you, do you know why a sick note is usually issued?
Yeah, sometimes it's, if someone's sick, but also I know that you can give them sick notes if, like a child is, you need to look after a child because they're dependent on me and stuff.
I see. All right. And did you hear that from somewhere? That a sick note can be given for any of these 2 reasons?
Yeah, my best friend Patricia, yeah, she was telling me about that.
All right, sure. All right, Emma. So can we discuss a few things a little further, if that's all right with you.
Absolutely, yeah.
So you mentioned you have two children at home,
Hmm.
and you and your husband take care of your children. And who takes care of the children when both of you are not around?
Um, no one really. It's just between us two. That's why I'm in a bit
Oh,
of a pickle at the moment.
oh, I see. And do you have any family nearby?
No, we don't. We're a bit isolated actually. We live up north, Manchester. Everyone else is down in Bournemouth.
And is there any particular place other than home that the children go to?
Yeah, they've gone to the nursery here and there, but we can't really afford it.
All right, I see. All right, Emma. And how was your pregnancy with the children?
Yeah, that's fine.
Any complications that you had to that you underwent during the pregnancy, the delivery?
No complications at all. No, it's all
Was there
fairly
any?
routine.
Oh, that's good. And was there any reason that the children were detained in hospital for longer than they were required?
No, they weren't.
All right. And how are the children otherwise, health-wise? Are they fit?
Um, no, they're absolutely fine.
Oh, that's nice. And are they eating well, playing well?
Oh yeah.
Okay, that's good to hear. Are you happy with their red book?
Yeah.
Are you otherwise facing any issues at home with the childcare support?
Other than what I've talked about, no, nothing else. No,
Okay, I see. Um, so, um, Thank you for discussing that with me, Emma.
that's okay.
But all right, so coming back to the sick note, unfortunately, a sick note cannot be issued for when a person is not, unwell. So, a sick note or a fit note is actually something that a healthcare professional assesses to see if a person, an individual, is able to work.
Hmm.
Do you understand what I'm saying?
Yeah, but I'm not able to work.
Unfortunately, if there is no medical condition or if there is any no indications that health wise or medically to say that you're not fit, we are not supposed to be giving out sick notes for those reasons.
Oh, I see. Oh God, that makes sense. Okay.
Hmm. Um, but let's explore other ways there where you can get some help. Right, I understand this is a major issue, especially for when both the parents are working. Childcare could be a little bit of an issue.
Mhm.
But
2 minutes remaining.
Can you tell me a little bit about your work?
Yeah, I work as a nurse in a hospice.
I see. Have you had a chance to talk to your supervisor regarding this?
No, I haven't. No, and I didn't think about that.
Oh, you can probably try that. Otherwise, do you have any sick leaves, paid and unpaid?
Um, Sick leaves. I
Mm-hmm.
know. I'm trying. That's why I need a sick note is because I want to apply for sick leave.
Yes, I'm sorry. I meant, do you have any annual leaves or any unpaid leaves?
Oh, my annual leave. Yeah, that's all fully booked now. I've used all that up. I went on holiday to Spain earlier in the year.
All right, I can understand. Yeah, it's quite a predicament. I could also get you in touch with the Citizen Advice Bureau. Maybe you can look into different avenues of if you can, if they can help you out with child support, right,
Okay.
financially, and also help you out with child support. That's also something we can explore.
Oh,
Yeah,
great. Yeah. How,
how does that
they
sound?
sounds expensive though. Are they going to charge me?
I don't think they will charge you. They will see what you're eligible for, and accordingly, they will advise you. How about I give you some leaflets and pamphlets so that you know a little bit more about this, and also I'll get you in touch with them. How does that sound?
Yeah, sounds good. Yeah, worth a try. I mean, is there any? I heard my friend Patricia. She got
Mhm,
free
mhm.
childcare for
I
her
see.
kids. I was just wondering if that's something I'd be eligible for.
So at this point, I'm not in the position of advising you on whether you are eligible. So how
But
about
I'll
I
ask for
get you?
citizens' advice.
Hmm. So I'll get you in touch with them, and
Okay,
they can guide you through the
Move
right
on to
channel.
the next station.
right. How's that?
That went well.
Hmm?
That went well.
Yeah, it's good. Um, I don't know why, but when somebody's got an issue at work,
Hmm.
people don't forget to take a work history. They forgot to ask about work in their data gathering, and they remember because it is important. They realize it in their management, right?
Hmm.
And then they go back, which is fine because we're all human. We forget things, but we should always focus, on the basics first. She's at work, so that's
Hmm.
going to be a big bulk of our data gathering. But yeah, it was good. It was good, and generally it was quite, flowed quite nicely, and
Hmm.
um, yeah, I think it transitioned well between different topics. It was good. And you kind of you dealt with, because obviously she's quite direct at the beginning, asking for a sick note. So it was
Hmm.
good, that you explained to her that you're going to have to assess first her fitness to work.
Hmm.
You can't just issue fit notes. You can't just issue fit notes,
Hmm.
without first assessing them
That
first.
helps.
So
Mhm.
yeah, that was good. So I think it is worth explaining that to the mother at the
Mhm.
beginning, and then transitioning into your data gathering from there with an open
Mhm.
question, perhaps. So yeah, just a bit of a background about fit notes and sick notes, which are the same thing. So a statement of fitness for work, also known as a fit note, sick note, or a med 3, is based
Mhm.
on an assessment by a healthcare professional about their patient's fitness for work. So law requires that the healthcare professional, you, to undertake an assessment, in whatever form, in whatever medium, or
Mhm.
either another person to do the assessment, but you to get a letter from them or something, in order before you can actually issue a fit note. So you are well within, you are justified in making sure you ask questions first, because if you didn't, then that would be not only unethical but against the law. So yeah, so and then why are they asking for a fit note? It's so that they can apply for statutory sick pay, right, or sick leave, basically.
Mhm.
And so there's different types of leave, right? So you asked me about annual leave, didn't you? There's different types. So sick leave is what she wants, right? Because that's a paid type of leave. Another type of paid leave is annual leave. However, most people aren't keen to use up their annual leave because that's usually what people use for their holiday. Because as a worker in the UK, you're entitled to 28 days of annual leave every year,
Mhm.
at least 28 days. And most
Mhm.
people use that to go on holiday. Um, so, you know, for this kind of issue where she's looking after the kids, she doesn't really want to use up her annual leave for that. Now, it may be, in some circumstances, it may be that she tells you, "Oh, I hadn't thought about using my annual leave. Yeah, I'll just do that," and she just accepts that. Or it may be that she tells you she's used up all that annual leave, right? In
Mhm.
which case, you have to suggest something else. That would be like the first thing I would suggest because it's paid.
Mhm.
Um, and she did mention, which I think you should explore a little bit more about financial problems. Mention that
Mhm.
because one easy solution is just pay for a babysitter, pay for a nursery,
Mhm.
childcare, playgroup.
Mhm.
Obviously, she can't do that. She's having financial problems.
Mhm.
So that's annual leave, right? That's another
Mhm.
paid form of leave. If she says, that's all been used up, then you can suggest other things, right? So another
Uh-huh.
type of leave is parental leave that you can discuss. Now
Mhm.
that is unfortunately it's not paid leave. It is unpaid leave. However, their rights as a worker stay intact. They can get back to work. They were not going to get fired, right? So
Mhm.
so that's like a last resort kind of thing, which all
Mhm.
parents are entitled to quite a lot of
Mhm.
parental leave. It's just that they're not paid during that period. So you can suggest that. There are some other suggestions as well, which we'll come on to those in a second. So yeah, a bit of empathy, you know, like Eve protocol is always good. I like Eve protocol, but I like to add something positive afterwards. So I don't want to end it with this bit. This usually is the empathy bit is usually, I'm really sorry. But then we're here to help them, right? So let's finish it on a positive note. So I'm really glad you've come today, so we can, you know, see if there are any ways I can help you today. You know, but I'd first like to ask you a few more questions because, as I explained, you know, I need to assess your fitness to work before I can issue fit notes. So can I ask you a few more questions, just to give myself a bit more of a background about yourself? Would that be all right? And then just transition into your data gathering. So in terms of your data gathering, right, I would ask about work. Obviously, you asked me if she's currently suffering from any sicknesses or ailments, but I'll also ask a bit more about her work, the nature of her work. Because if it was an office job, then it may be that she can work remotely from home. You know, like a reasonable adjustment can be made with the employer. That might be something. So if she does say that, that might be something you can suggest later on in your management. So let's ask all the relevant questions and link them to our management later. So we're thinking, oh, work. Has she talking to her work yet? Because it may be that she may be entitled to some forms of leave, right? Whether it's paid or unpaid, which we talked about. So ask definitely a question not to miss in your data gathering is, have you spoken to your manager? What did they say? She'll probably say she hasn't, right? What do they say? Or occupational health, because she works in hospital. So so that's one thing. So we want to explore that because the employer is going to have a big role in solving this problem for her, isn't it? Or she. And then the children. So we want to establish the children. The main thing really, it doesn't matter if they're well or unwell. There's another case. This one here. Chickenpox. Yeah, the children are unwell, but she's still not eligible for a sick note because it has to be herself that needs to be unwell. You know, not fit to work. For the doctor to issue a fit note, you can't issue a fit note on the basis, you know, of caring for. It's a childcare issue. So these are both very similar cases, right? They're childcare issues. The reason why she has a childcare issue differs, but it's the same principles. And then, so disabilities, yes, because if the child is receiving, or the children are receiving disability allowance, living allowance, then they will automatically be eligible for free child healthcare. What else will make them automatically eligible? If the family receive any income support, the common ones, universal credit, income-based job seekers allowance or JSA, income-based employment support allowance or ESA. Those three are the common ones, right? Any other types of welfare benefits, if they receive them, they're automatically eligible for free child healthcare. Now, how do we know if she's eligible? We can ask her about her finances. How's everything going? You know, signpost it before you do that. You know, a bit of an intrusive question. Apologies in advance. How's the financial situation at the moment? Any difficulties at all? But then, and then we can talk about. There's actually an application she can fill in online, right, where she can apply for a code. They got on the gov.uk website. 20-minute application. It's basically going to be based on her household income. Basically, if her household income is below a certain level, then her application will be granted. If it is, so you can tell her it might be worth a try. If it is accepted, then you would be eligible for 15 hours of free childcare every week, which is a lot, right? She'll have to pay for like nappies and trips and stuff like that, food, but for the most part, it's free. And I liked how you asked me about this question because a lot of people, they don't understand. Remember in the question, it says, address her concerns. And then they don't ask the patient the concerns. They ask them, they're so keen to ask about smoking and alcohol, even when it's not relevant. But they don't ask her, what are you most worried about? Which is what they've told you to do. So when you see that word concerns, always think, I cannot forget ice in my data gathering. So yeah, definitely include ice. And remember, guys, ice is not just ideas about what the diagnosis might be. ICE is any thoughts, right? So her understanding of sick note, that's what Dr. Ann asked me. Understanding of sick notes, What's your understanding of when we as healthcare professionals issue sick notes, or when we can issue sick notes to our patients? What's your understanding? That is an idea, okay? What else is an idea? A follow-up patient, say they've been started on some treatment, and you're asking them, you know, have you had any thoughts about the treatment going so far? How's that been going? Ideas, right? Thoughts, general thoughts in the patient's mind. And then concerns is obviously important. So in concerns, it might be an obvious concern, right? They might have already presented with a concern. So what you might do, does that mean you don't do concerns? No, it does. Other than XYZ that you mentioned, okay, because you're showing the examiner you're listening as well, and you're showing the patient you're listening. Other than XYZ, was there anything else that you're particularly concerned about? Other than XYZ, was there anything else you were hoping that I'd be able to do for you today? You know, you mentioned that you wanted a sick note. Was there anything else at all that you were hoping I'll be able to do for you today? So ICE, don't forget ICE. People ask, oh, is it okay if I run out of time? If I don't have much time in my data gathering because I spent too long asking about smoking when it was irrelevant, is it enough time to fit in ICE? Can I miss it out? Well, no, because you're not seeing the patient. These people who ask this question are not seeing the patient using the biopsychosocial model. They're seeing it just the biology. They're just thinking, I need to diagnose the condition and I need to treat the condition. So Bob is with migraine is treated the same as Michael with a migraine. They treat them the same, but actually management should be biopsychosocial. So where do we get bio from? You get your bio bit from exploring the presenting complaint, the symptoms or the concern, and the general health, right? Your PMAP. That's your bio. But what about your psychosocial? Where'd you get psycho from? Psycho does not mean mental health, just mental health problems, depression. It doesn't just mean that. It means what's going on in the patient's mind. So ICE assessment is what's going on in the patient's mind, right? So when you get to your management, you mentioned that you were worried about this. Let me assure you that this is part of your management. Management is not just, managing the condition. You're managing the patient's mind as well, and you're managing the patient's life too, because in this case in particular, so social history, right? So when I say biopsychosocial, so social, that's the final part of your management, is socially. Work, is it affecting your work? Is it affecting your at home, your day-to-day activities, mobilization, getting dressed, feeding, all those things, right? Your mental health. So these are all the effects, but generally social is your life, work, home, relationships, all that stuff. How is it affecting? Because that's important to the patient, right? So we're managing the whole patient's situation. And then this is a perfect example, right? So just that was a bit of a tangent about ICE, but I just wanted to explain that a bit more because it's very, I would say it's the biggest underlooked part of a history in people is ICE. It's the most overlooked, part of a history. Yeah. Right. So in this case, so always in cases, and me and Dr. Adam have spoken about this before, is 3 key issues and how you would manage them. In each case, when you're going through cases, guys, because there's so many, just think of each case. What are the 3 key issues, okay, that I need to identify, and how would I manage them briefly? Right. So because you don't want to neglect key issues, you don't want to focus on details. You want to focus on the main, the gold stuff, the zibda that we say in Arabic, right? So in this case, what's one of the key issues? Okay, she's asking for a sick note, she's not eligible. Okay, I need to say no. That's one key issue, isn't it? Number 2 is, well, she's got a valid problem, isn't she? She's got a serious issue. We don't want her ending up going to work and leaving her children at home. So we need to see if we can offer some kind of help. So make some suggestions based on the data gathering that we got. Linking the data gathering. You mentioned that well, can I suggest or what I can do to offer solution? And then the final thing is just safety netting. Just make sure that if she gets lost, that you can encourage her to come back. I think yours was good. I think that was the only thing that's missing. I would just give that little safety netting for them. In these kind of stations, these are concern like counseling based stations, right? I know it's ethics, but it's primarily counseling, isn't it? So questions or concerns is your safety netting, isn't it? It's not necessarily red flag symptoms or delayed or missed appointments. It's going to be or resistance to treatment. It's going to be questions or concerns or kind of resistance to the management plan that you're giving there, or the advice that you're giving there, right? So how do we go about doing that? So very well, me saying do this, do that. How do you actually do it? So thank you, Mrs. Jones, or whatever her name is, Mrs. Willis, for answering my questions. I know some of those questions were quite intrusive, so thank you for bearing with me. And I can see that, you clearly are in a really difficult situation. So I really do empathize with you. I'm really sorry, about the situation you find yourself in at the moment. However, unfortunately, I won't be able to issue you with a sick note today. I'm really sorry. The reasons being, the sick notes, you mentioned earlier that you can issue sick notes on the basis of a childcare issue. Unfortunately, we can't issue sick notes for childcare problems. As unfortunate as they are, what we can do, so unfortunately I won't be able to issue with a sick note today, because they can only be issued if you yourself as my patient are sick and unwell and not fit to work, which you are. However, okay, don't dwell on the negative. However, there may be some other avenues where you may be eligible for some support or some suggestions I can make to help you with this problem, right? And so you just go into it. Can I suggest that you mentioned that you haven't spoken to your manager yet? Can I suggest you speak to your manager? It may be that you're eligible for other leave options, right? You mentioned, so you're asked for sick notes to get sick leave, but there are other types of leave that you may be eligible for. So definitely, it might be worth having a chat with your manager and discussing those with them. And you can go on to talk about the specifics that we talked about, your annual leave, parental leave, right? If she's got a job that can be done remotely, for example, reasonable adjustment for her nursing home, there's not much reasonable adjustments really. She needs to be at home with her kids, basically. And she can't work from home. And then Citizens Advice Bureau, which is really good that you mentioned that, because that will save you in a lot of these scenarios, right? Because Citizens Advice Bureau offer free employment advice, financial advice like benefits, seeing if you're eligible for benefits, and also legal advice, free legal advice too. So very, very useful service. Long waiting list though, so if you call them, it'll be a very long time before you get hold of them, but they will eventually call you back. So that's the Citizens Advice Bureau, yeah, really important. And then finally, what you can do is you can print off this leaflet for her. So, this leaflet, print this off for her with the link, and then she can start and apply for this. 20 minutes, it doesn't take very long. Fill in a few details, and she can see if she's eligible or not. Now, what are you going to say to the patient? Well, you say to the patient, well, it may be that you might not be, that your application, I can't guarantee that your application is going to be successful or granted. However, I do think it's worth trying, maybe worth trying. But then safety net. So if these measures don't work, if you still find yourself not coming to a resolution, then please insist, please do come back. Okay. Do come back and we'll explore some other options, see if there's anything else that we can do. Yeah, so you can give her the leaflets about those things. But yeah, generally, you remember when you're dealing with these scenarios, right? Unreasonable requests, saying no, whether it's euthanasia, whether it's a sick note, or whether it's change my notes, because she wants you to falsify the information. You need to say, look, empathize. I really appreciate it. It is a very difficult situation that you're in. However, unfortunately, I won't be able to issue you with a fit note in this case today. I'm really sorry. The reasons being XYZ. You mentioned that your understanding of sick notes is that they can be issued for childcare issues. Unfortunately, we're not able to issue them for those reasons. The only reason we can issue sick notes are when you yourself as a patient are not fit to work, are sick. However, there may be some other avenues where we might be able to help you in order to to resolve this problem. So can I suggest, it's the same whether it's a ankle sprain or whatever, or whether it's antibiotics. She wants antibiotics for a viral infection. Can I suggest, these things? You mentioned that, you haven't spoken to your manager. You mentioned that, you haven't applied for any, you're having some financial difficulties at the moment. So it may be that you could be eligible for free child healthcare. And actually, 2-year-olds, if the application is accepted, parents are eligible for 15 hours a day of free childcare. So that might be something where I can't guarantee application will be accepted, but I'll give you a leaflet that will give you information about how to go about applying. And then how that works, by the way, is that if it's accepted, they get a code. They'll get like a code, and so they can give that to the child giver, like the nursery and stuff, so that that will be paid for by the government. Yeah, very good. Yeah, it was a really nicely structured, spaced out. You did incorporate ice as well, which is good. And you did ask Chris's advice for it. So a bit more about work, a bit more questions about work, and then you can link it to your management. Yeah, and then and just safety net at the end, because you as a doctor, we always want to think, what's the worst that could happen in each station? Think, what's the worst that can happen? The worst that can happen is that she goes home, these all measures fail, or she doesn't try them at all, and she just says, oh, I can't be bothered, I'm just going to go to work and leave my kids at home, right? And then the kids die or something, or something happens to the kid. That's the worst that can happen. And then there's a big investigation, and you guys have studied medical errors, right? So there'll be an investigation into these kind of things. And then guess what? You haven't documented that you safety netted, that you asked her to come back, you offered her to come back if it doesn't resolve these measures. And so you're the one that's in trouble. You're the one that's going to be on the line. So you have to always think, what's the worst that can happen? So remember, guys, psychiatry stations, all of them, pretty much, you need to assess for red flags, such as what? Risk to self. Yes. Risk to self, risk to others. So, for example, risk to others, there's two really where they can pose a risk to others. One is like a psychotic patient with schizophrenia who thinks he's being spies are plotting against him, so he's like carrying weapons and stuff. So he's risk to others. And then the other one is bipolar as well. They often can pose a risk to others as well. I don't think there's a public case where the grandiose delusions one. I don't think there was any risk to others in that one as such. But that's potentially the two conditions where there could be depression as well. You can as well. But because depression have psychotic depression, there's psychotic depression, so you can get psychosis. But the psychosis experience is usually mood congruent. So if they've got bipolar and they're in a manic episode, guess what? It's a psychosis. It comes in the form of delusions where they think they're the god or the genius, they think they're Jesus or whatever it may be, right? If it's schizophrenia, it's persecutory delusions, like they think people are plotting against them. If it's depression, it's that I'm useless, everyone hates me, blah blah blah. They're all out to they all hate me, I'm disgusting, I'm this, and they'll have like really extreme kind of mentality where they think people are going to attack them as well. But anyway, psychotic. So they're mood congruent anyway. The point is that when you're thinking about what's the worst that can happen in psychiatry, if a young male comes to you, first presentation, and you diagnose them as having moderate to severe depression or severe depression, and you didn't either offer a Samaritan's number or crisis card, or assess their suicide risk, then you're probably not going to pass the station. As a young male come to you with depression, you've not done that. That's like, it doesn't matter how the rest of your station goes. So psychiatry generally, red flags, self-harm, risk to others, and also ask them if they've got any children at home as well. Safeguarding issues, because if she's depressed and she's self-neglecting and she's got kids at home and she's completely neglecting the kids too, that's also risk. Okay, so risk is always a separate, in terms of management, that's a separate area where immediate, because a lot of psychiatry, I'm going off on a big tangent here, but a lot of psychiatry can be managed in the GP surgery, right? Even moderate to severe depression managed in GP surgery, as long as there's not risk. But if there's risk, then they need immediate kind of assessment by mental health specialist services, whether it's crisis resolution team, or whether it's in the case of schizophrenia or there's risk to others. I always forget what it's called, but it's EIP for short. Same day assessment, EIP. Do you remember what it's called, Dr. Rao?
Intervention for emergency intervention for psychosis.
Psychosis. By the way, guys, psychiatry management, poorly understood topic. Okay, people are managing psychiatry patients completely wrong. So make sure you're familiar with the NICE guidance, because you're coming in, right? It's in a GP, so most presentations in psychiatry are in a GP surgery setting. It may be later that they get referred to, specialists, but for the most part, most mental health issues are dealt with in the community. Okay? They're not referred. GPs, a big burden of their work is mental health stuff, and they manage a lot of it. Even moderate to severe depression is managed in the community, right? It's only like we discussed, the ones with risk. Even CBT, by the way, is done by an IAPT program, improving access to psychological therapies, IAPT program, which is part of the GP network. It's not a specialist. It's not the psychologists there. They're part of the community. Okay, so you don't actually refer them to a psychiatry. Then psychiatrists deal with the real extreme cases, like the mad cases, basically. But yeah, really good. So yeah, so I think that's a good one. A lot of people they're not, because obviously, nor should anyone expect them to know how employment works, like leave and stuff like that. So it's good to have an understanding. It may be that they tell you they've used up all their annual leave. It may be that they are open once you suggest annual leave, that they're actually fine with that. So just be prepared for whatever variation you get, because there's obviously always going to be variation, and understand the principles, and you'll be fine. And Dr. Anne understands the principles well. So yeah. So key issues, 3 key issues. Remember, safety net, and remember to ask more about work if she's speaking to manager, but otherwise, but you brought it back in your management, so that's fine. Right. So that's the case. Anything anyone wanted to talk about in the case at all?
Thank you so much.
Anyone wanted to talk about? Thank you, Doctor. About that case, any questions at all? Right. Okay. No questions. Yeah, feedback, guys. You need to read this feedback. You need to make sure you understand this. It's not enough just looking at the actual feedback form. You need to actually read what it means. What does issues mean? Yeah. And, examinations is all part of the data gathering as well. So yeah, that is sick notes, unreasonable requests, sick notes. How to say no in a sensitive manner, suggesting that there are alternative ways that we might be able to help. So however, there may be some other avenues where we may be able to help you. Can I suggest that you do XYZ? What I can do is ABC. And then if you don't come to a resolution with those measures, please do come back. Urgently come back. We'll explore if there's any other options at all. And then safety net. Yeah, so that's the safety net. Does that make sense? So it's 4:45. We started at around 4. Oh, that's quite a long time, actually. I've been talking for ages. No questions? Anyway, hope you found it useful, guys. Thanks for coming. And we will do another one of these soon. All right. Thank you, Dr. Iman. Take care. Bye-bye.
Thank you.
Thank you, Dr. Zaid.